School systems around the country have extended their holiday break or switched back to online instruction because of the explosion in the COVID-19 cases.
Others are pressing ahead with in-person classes amid a seemingly growing sense that Americans will have to learn to coexist with the virus. School districts in cities such as Milwaukee, New York, Detroit, and beyond found themselves in a difficult position at the start of the second half of the academic year because of the super contagious Omicron variant. While many parents want their children back in school, while some teachers fear infection.
The U.S. is expanding COVID-19 boosters as it confronts the Omicron surge. They're now available for kids 12 to 15 years old once enough time has passed since their last dose.
But just how much will this help in Utah's fight against COVID-19? As national pediatric cases are on the rise, ABC4's Jordan Burroughs looked into our local numbers. And Jordan, you talked to doctors today. What are they telling you?
Yeah, it's important to first put those COVID-19 numbers into perspective. Like you had mentioned, almost 15,000 COVID-19 cases since last Thursday have been reported by the Utah Department of Health. And out of those, about 1,800 of those were from kids the age of 18 or younger. So that's about 12%. And I spoke with Dr. Andy Pavia with Primary Children's Hospital. He says with the kids under 18 years of age, there are more hospitalizations, there are more disease, there is more disease, that is, but he does say he's just glad it's not the other end of the spectrum.
We are bracing ourselves.
Utah's medical professionals are bracing themselves for an increase in pediatric COVID-19 cases soon.
Because in the cities that are a week or two ahead of us, on the East Coast and the central Midwest, pediatric hospitalizations are hitting all-time highs for COVID.
Hospitalizations due to COVID in school-age children are not rising, but Dr. Andy Pavia with Primary Children's Hospital says the new variant is causing more disease.
Omicron seems to be playing out a little bit differently in children. They seem to be more likely to get infected. Younger kids seem to be more likely to get in enough trouble that they need to be hospitalized for oxygen.
As of Monday, the FDA has approved a COVID-19 booster shot for kids 12 to 15 years old as long as enough time has passed since their last dose. They must wait at least 5 months to get the booster. Original vaccinations opened for the younger teens, those 12 to 15 back in May. That means those first in line in the spring, thousands of them are set to get the booster.
They know that a lot of people they know have gotten very sick with COVID, and it's something people are scared of. And here's their superpower to help protect them.
Dr. Pavia says Utah fares better than the national average in getting 5 to 11-year-olds vaccinated. 12 to 17-year-olds are on par with the average. However, the general population is lagging behind. Dr. Liz Close, the executive director of the Utah Nurses Association, says as hospitalizations rise, more nurses are quitting because of the immense workload.
I have never heard nurses in my 46 years speak of feeling broken. And there are many that are feeling broken, that there's nothing that they can do to change this. And it really is up to the public to take hold of this and say, we have an opportunity to prevent this level of disaster that's going on.
One of the next big milestones in the fight against COVID-19 is the booster shot for 5 to 11-year-olds. I asked Dr. Andy Pavia about that. He says just give it a few more months and we should be able to know when the booster shot will be available for that age group. Reporting live in Murray, I'm Jordan Burroughs, ABC4 News.
Thank you, Jordan. Now to new data showing just how much a hospital visit